Hi all. Today we'll look at the differences between the ESR and CRP tests, two important investigations used to detect and monitor inflammation in clinical practice. Let's begin with the ESR, or erythrocyte sedimentation rate. ESR measures how quickly red blood cells settle at the bottom of a vertical tube over 1 hour. In inflammation, the liver releases proteins like fibrinogen, which make red cells stick together and form stacks called rouleaux. These heavier clusters settle faster, leading to a higher ESR value. ESR is an indirect and non-specific marker of inflammation. It rises in many conditions, such as infections, autoimmune disorders, malignancies, and even in physiological states like pregnancy or aging. Because it depends on several factors, ESR can be influenced by anemia, polycythemia, and changes in plasma proteins, not just by inflammation. A key point about ESR is that it changes slowly. It increases gradually after inflammation starts and may remain elevated for weeks even after recovery. This makes it more useful for chronic inflammatory diseases such as rheumatoid arthritis, temporal arteritis, or tuberculosis rather than acute infections. Now let's turn to the CRP test, or C-reactive protein. CRP is an acute phase protein produced by the liver in direct response to inflammatory cytokines, especially interleukin-6. Unlike ESR, CRP is a direct biochemical measurement of inflammation. CRP levels rise rapidly, within 6 to 8 hours of inflammation onset, and can increase hundreds of times above normal. Once the inflammation resolves, CRP also falls quickly, often within a few days. Because of this rapid response, CRP is very useful in identifying acute infections, sepsis, and inflammatory flare-ups. Clinically, CRP helps in monitoring treatment response. For example, a falling CRP level after antibiotic therapy suggests improvement. It can also help distinguish bacterial infections, which usually cause a high CRP, from viral infections, which typically cause a mild rise. Let's summarize the main differences. ESR measures how fast red cells settle. CRP measures an actual inflammatory protein. ESR rises and falls slowly. CRP responds quickly to changes in inflammation. ESR is influenced by non-inflammatory factors. CRP is more specific for active inflammation. ESR is useful for chronic disease monitoring. CRP is best for detecting and tracking acute inflammation. In short, ESR reflects the presence of inflammation, while CRP reflects its intensity and timing. Used together, they provide a more complete picture of inflammatory activity in the body. Thank you.